So, Doctor, pleasure to meet you. Thank you
you.
very much for publishing this study.
Absolutely.
Tell me a little bit about that study.
About this study?
Yes.
So I'm a cardiologist, and so one thing that I and my colleagues do is a lot of heart catheterization. And one technique is to get vascular access in the radial artery, which is very close to the radial nerve, and sometimes that gets damaged. So I had a patient come back with radial nerve injury, pain, numbness, and decreased mobility, strength in her pincer fingers, which is governed by the radial nerve. And then with the ICEWAVE patch, in one application, using our standard mapping techniques, we were able to sort of double her range of motion strength and cut her numbness in half, kind of instantaneously with the ICEWAVE patch. So I got a gripometer, digital gripometer, to show that before and after the patch, we were objectively increasing her strength in those fingers, and wrote up a case report, and we had that published last week in the Journal of Interventional and General Cardiology, which is a European-based journal. It's sort of a mid-tier journal for cardiology, but still very well respected, and that was a nice result. You know, I have a feeling my colleagues would be more inclined to these things if there were cases or something in our literature that they could refer to. So I'm hoping that eventually practitioners will get more excited about or more confident using LifeWave or recommending LifeWave when they start to see little reports like this in their own literature.
Definitely. Thank you very much, Doctor, for what you're doing.
Absolutely.